Hey, welcome to News You Can Use. I'm your host, BG. Can I ask you a question? Why is it that when you have the flu, you're expected to stay home, but when you're suffering with your mental health, you're expected to suck it up? Well, the Toronto Youth Cabinet is asking that same question. Now, before we get into the details, I do need to do a couple of things, like subscribing to this channel, tapping that notification bell, and make sure to follow us on all of our social media. Those details are in the description below. I want to introduce you to Stephen Mensah. He's actually the executive director of the Toronto Youth Cabinet, who are pushing the government to make big changes to provide better support for students struggling with their mental health. He's here to explain what changes he's looking to see, including allowing students to take sick days for their mental health. Let's bring him in. Stephen Mensah, Executive Director of the Toronto Youth Cabinet. Thanks so much for joining us on News You Can Use.
Thanks for having me, Brandon.
I think we should start off by explaining what is the Toronto Youth Cabinet.
So the Toronto Youth Cabinet is the City of Toronto's official youth advisory body.
Okay.
We were established in 1998 by Toronto City Council. So basically we have the mandate of advocating on behalf of Toronto's over 600,000 young people who live, work, or go to school in this city.
And we're talking like councillors and the mayor listens to you guys.
Exactly, yeah. We advocate on behalf of the young people to the mayor and to all the city councillors, and we work with city staff and others as well to get things done.
That's a pretty powerful position.
It is. I mean, oftentimes it takes more work to get things done, but it's still a privilege to be able to be in this role and raise the voices of our young people.
Well, let's talk about it, because I know you guys recently launched a new campaign regarding mental health.
Yeah.
So tell me a little bit about this campaign.
Yeah, so the Toronto Youth Cabinet launched a student mental health survey in the last school year, basically to hear from young people about the state of their mental health and what they would like to see school boards and the provincial government do to address the rise in youth mental health crisis facing Ontario and honestly Canada. And so, young people, they gave us the solutions, they gave us the things that they wanted to see done.
And what were some of those things?
So, in the survey, 98% of young people said that they are in support of mandatory mental health literacy in the curriculum. 94% of students said that they are in support of mandatory mental health training for all school staff. 67% of students said that they need BIPOC representation in the mental health workers.
What do you think was the biggest takeaway from the survey?
I'd say the biggest takeaway has been, young people need help. They're struggling, they can't find help, they're unable to access that support. And so young people made it clear that, we're struggling, we need support, we need more support, and we need it urgently. So young people have highlighted the fact that they're burnt out and just this constant school closures, the online learning, the fact that they've been isolated from their peers and friends, it hasn't helped the situation. And so, right now, young people are really going through it, and they need more support from their schools and from their government to address this.
Because I was reading about mental health days in particular.
Yeah.
What is that concept?
Whilst we launched our survey, we also called for mental health days for students across Ontario. So basically calling on the government to include mental or behavioral health reasons as an excused absence in the Education Act. Because currently in the Education Act, there are 7 legally excusable absences a student can take or miss school from, and mental health is now one of them. And we're also moving forward to say that the government should ensure that anyone who wants to access those days do not have to provide a doctor's note, because we believe that financial troubles and not being able to afford a doctor's note should not be a barrier to accessing these days.
I would like to know, because you guys advocate to Toronto City Council, but education is a provincial responsibility, how would that look?
Yeah, so the Toronto Youth Cabinet has a long history of advocating to the province on many issues, especially in the education portfolio. Just recently we were able to successfully advocate for free menstrual products in all Ontario schools, as well as financial literacy in the Ontario curriculum, and so on and so forth. So our approach when we advocate is provincially, obviously municipally, and even last week we were able to meet with the education minister to lay out these recommendations to him.
What was his response?
I'd say, and we appreciate, Minister Lecce's constant support on the work we do, and I'd say his response was, he acknowledges there's a willingness, and right now there is a willingness on his part, and right now he acknowledges that it's an opportune time to take action to address the mental health crisis.
But do you think he's going to take action?
I'm optimistic. Honestly, I'm optimistic that he will take action, because I know even in the next couple of weeks he will be meeting with more students and stakeholders on this issue. But one thing that we've been pressing and we're going to continue to press is the fact that we need urgent action to address this crisis. And although we can acknowledge that right now is a good time to address it, acknowledging it doesn't mean anything if we're not actually going to take the steps to really go ahead and do it. So I'm just waiting and seeing.
I'm sure a lot of students who are going to be watching this are going to be like, how can I support this? Or how can I have my voice heard? How can they do that?
Simply, I'd say, follow our social media at the Toronto Youth Cabinet, at TO Youth Cabinet, and even more importantly, continue to share your stories with us. Continue to let us know, what your experiences are, because in the next couple of weeks we're going to be releasing a joint statement with all of our education stakeholders as well as the children's health stakeholders to really send a unified message to the province that this is something that needs to be done. So continue to share your experiences, follow us on social media, and really amplify the message for mental health days as well as for the other recommendations that we're going to be calling for the government to take on.
Stephen, total sidebar, totally unrelated, but I want to ask you, are you planning on going into politics when you're older?
Honestly, yes, that is a goal.
Okay.
It is a goal.
What are we talking about? We're talking about mayor, we're talking premier, we're talking prime minister?
So I have three levels. First, I'm trying to be Minister of Education.
Okay.
Then I'm trying to be Mayor of Toronto.
Yes.
And then eventually Prime Minister of Canada.
All right now.
I'm brushing up on my French right now, but those are the three steps I'm trying to go to it politically.
All right, you better speak that into existence.
Amen.
And when you declare, okay, I like this guy. And when you're ready to declare, you come back here, okay?
I can't wait. Appreciate it.
All right, thanks so much for coming in.
Thanks for having me, Brandon.
Hey BG Squad, thanks so much for checking out our channel. And listen to this, we have more great content for you, like this video right here and this video right here. By the way, don't forget to subscribe to this channel right now and tap that notification bell.